I hope this also shed light on the horrific conditions that us DPW workers face on a daily basis.
The death of Baltimore sanitation worker Ronald Silver II 1 year ago this week exposed many alarming problems within the city's Department of Public Works. Silver's family told the city last week they intend to file a civil rights lawsuit.
One of the most serious concerns with this, more than 100 frontline solid waste workers did not have health insurance.
The comptroller proposed a simple fix: enroll everyone.
And WJZ investigator Mike Helgren has been on this story from the very beginning, and he's here to tell us why that did not happen. Mike.
Rick and Nikki, the mayor's office, through their representatives, voted it down. They say it interferes with union negotiations, but the comptroller and inspector general feel the rejection could put some of the city's most vulnerable workers at risk.
He was not replaceable. He was not replaceable to us.
Ronald Silver II's family has been fighting to make things better for his colleagues since he collapsed and died after a day picking up trash in the sweltering heat 1 year ago.
His eyes was rolling in the back of his head. He was rolling in and out of consciousness.
Ron Silver, who died on the back of one of our trucks because of dehydration, he did not have health insurance. And 135 other guys were also in that same condition, not having health insurance.
After Silver's death, the inspector general uncovered many of his colleagues had no idea they were not enrolled in the city's insurance plan. One only discovered it after he was hospitalized.
When we talked to them, so many thought they had health insurance because they thought it was automatic. It's not.
And they were not even receiving the $2,500 stipends they're entitled to for not taking the insurance. That's a lot of money for some of Baltimore's lowest paid workers.
We took that report. We came up with a solution.
Comptroller Bill Henry's fix: sign up every city employee for the least expensive health insurance plan automatically. If they choose to opt out, they can, but at least they're covered.
The comptroller says the city already budgets some $14,000 per employee for those benefits, so it would not cost anything to Baltimore's bottom line.
That is the city making the point in its own policy that we, the city, we want you to be covered by health insurance. Frankly, I thought that this would be easier than it turned out to be.
All those opposed say nay.
Nay.
Okay. This item is denied.
The three members of the city spending board appointed by the mayor voted it down, saying it would interfere with ongoing union negotiations, and noting they were able to enroll all but 5 of those flagged in the inspector general's report. Problem solved, they said.
This notion that nothing changed, I want to address that. That is not true.
Not so fast, the comptroller and inspector general say, fearing with the large turnover in DPW, it will just happen again.
I'm just very disappointed by that. The fact that, it was proven that we have a problem.
There's no good reason for them to oppose this. The only reason we can come up with is it wasn't their idea.
WJZ Investigates went straight to the mayor.
Why not automatically opt them in to get insurance, especially because they've got such physically demanding jobs?
We have negotiations with our labor unions, and they come to the table with things that they want to negotiate. This is one of the things that is a negotiable thing for them. But also, even beyond that, I want to be very clear that our employees, including ones in public works, they're smart, and they make the decisions on what they believe is best for them and their families, right? And when you look at, even after some of the things that happened last year, we went back and offered, some folks still decide not to.
That did not sit well with Silver's family, according to their representative.
It is baffling that the mayor and the city of Baltimore wouldn't want every one of its employees, especially those who face such difficult work conditions, to have health insurance. And here is just another example of them dropping the ball when they could have easily done the right thing.
If you don't want to do it, then I guess we will just have the vote and move on with our lives.
The comptroller still believes signing everyone up is the easiest solution, but he says it's pointless to bring it to a vote again because he'd lose.
But the idea that we would let anybody go out there without health benefits that they've earned just because we didn't feel like changing the rules to make it easier for them to get those benefits. That to me is kind of disappointing.
Those opposed say nay.
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 They've made their point that they don't want to do it this way.
So at this point, the proposal is not happening. The city says they will continue extensive outreach efforts to make sure everyone knows they have to sign up for health insurance. And DPW points out they've made great strides to protect and train workers after Silver's death, particularly in dealing with the heat. Rick and Nikki?
Mike, great coverage into a story that you continue to dig into. Thank you.